our standpoint and from the White House task force standpoint, they believe our mitigation steps were needed and are working. We also then talked about vaccine distribution and some of the challenges that we know are going to be out there, started talking about different ideas that different states had. Dr. Birx is excited about our program with long-term care and how quickly we activated it, looking at Kentucky's numbers, what a major difference that can make. And we believe that we are going to be one of the first states in the country to start those vaccinations, which we believe will come as early as this next Monday. Finally, one area that Dr. Birx thinks that we can and should do better on is youth testing. That's especially young adults 18 to say 30, and different ideas about how to set up testing that caters to that age range, and different thoughts about how we can do that, because what we've seen in universities especially, and she can show this in a comparison, that test every week is if we get folks 18 to 30 in a regular testing regimen, it doesn't just help us identify asymptomatic people, it creates behavioral changes that are very positive and reduce the overall spread. We appreciate Dr. Birx and her expertise. We appreciate the fact that their national data is saying the same things that our state data are, and we appreciate her support in the very difficult decisions that we have to make related to COVID-19 to protect the people around us. And we briefly talked about how in some states where action has not been taken, South Dakota being one, you can truly see the loss that we do not want to go through. And so how important it is to keep working and to realize this virus will still be very much with us in the coming months as we get people vaccinated. So with that, we'll open it up to questions on the meeting. And if the questions, hopefully we can give a good outline of what those conversations are. And again, right now, Dr. Birx is briefing legislators. So Phil Pendleton from WKYT.
Governor, the West Virginia governor was vaccinated, I guess, live. Do you plan on doing something like that soon, or do you know when that's going to be?
We expect to do that next week to build confidence, and we'll also invite certain other leadership, I know, that day. And it'll depend on when the Moderna vaccine comes in, but we'll be doing that next week. Karen Czar from WUKY.
Thank you, Governor. Did you and Dr. Birx have an opportunity to talk about the initial rollout of the vaccines, and how pleased or were there any hiccups that either of you discussed?
We did discuss the initial rollout. Right now, we believe that that's going well. The first part of the rollout is structured in a way to where it is going to go well, because we're targeting very discrete populations. On hospitals, we're targeting a population that is used to giving vaccines, and you can do it on site. With the long-term care, that program is set up with CVS and Walgreens, and so that's going to be very systematic. It's when we get through those populations, and for us, our educators, EMS, other first responders, that it's going to be real challenging. And we had a very frank conversation about how challenging it can be. Dr. Birx and I both agree that public sentiment is shifting very strongly in favor of the vaccine, and our biggest concern is going to be preaching patience and people being willing to wait until the right time, until we get the most vulnerable vaccinated. That we believe is going to be the biggest challenge as we move into the spring, and if we have to on this, move into the summer. But I got to tell you, I'm really excited about the vaccination schedule that's out there. We're still waiting to get official numbers on Pfizer's second and third shipments. We don't have those. I will feel better when we have those. Tom Latek from Kentucky Today.
You just answered my question. I was going to ask if there was any new information on when the next shipments after this, the initial 100,000 or so were going to be.
Well, we believe, so this first shipment was about 38,000 Pfizer BioNTech vaccines. Moderna, we hope, will receive emergency authorization the end of this week through the weekend if the same schedule fits. Certainly it passed an FDA panel today, which confirmed the high rate of effectiveness. That's really exciting. And so we believe that we will have Moderna next week. We just don't know the dates yet. And remember, that entire shipment, which is 70, close to 80,000, is going to ensure that we have some allocation for every acute care hospital across the Commonwealth, meaning those that are interacting with people who may have COVID and treating them. That's our healthcare capacity, that everybody gets a start at vaccinating that workforce. Debbie Yetter from the Courier-Journal.
Did you and Dr. Burks discuss any specific steps amid this sort of heightened state of danger, like reopening restaurants and bars and resuming in-person classes?
Well, Dr. Burks is concerned about indoors activities, period, and we understand that. That's why we have capacity restrictions. And here in Kentucky, even when we revert back from the steps we just made, we have some of the more aggressive steps that have been made around the country. And I think Dr. Burks and those on the White House task force see us as being a leader and doing tough things when we have to. But I believe that everybody's concerned, Dr. Burks included, about these next months, especially how cold it is today and how much that may push people inside. So they're closely watching our data, just like we are. Joe Ragusa.
Hi, Governor. Actually, kind of following up on that specific topic, but guidance on bars and restaurants and guidance on school closures. I know that those are two areas where there seems to be a little bit of deviance between the state and the White House recommendations, at least the level of bars and restaurants being reopened and kind of advice on K through 12. But so in that regard, what were the conversations like between you and Dr. Burks on those two areas?
Well, I think they're very positive. Dr. Burks, we had the discussion about how high our community spread is, how significant it is, and she fully understood our decision when it came to schools. We talked about January 4th or January 11th, and specifically talked about once we have nursing homes beginning to be vaccinated, being able to pull some of the testing, once you have everybody vaccinated, out of a facility and push it towards schools. And so Dr. Burks believes that we can address some of the concerns that we have, and I think she shares those concerns based on the exponential growth, and agrees that it's a step that if you take, can slow exponential growth, but in being able to move some of those, especially rapid tests, once we've gotten well into our nursing home program into schools, can make a difference. On restaurants and bars, White House recommends 25% indoor dining in restaurants. I think that they would prefer that we close all bars, but still we have one of the more aggressive steps in place, and that's recognized. Mark Vanderhoff from WLKY.
Governor, do you have any hope that Dr. Burks' meeting with lawmakers might assuage any lawmakers who have been highly critical of the steps that you've taken?
I hope so. So we open it up to leadership in both the House and the Senate, majority and minority. I think we've got President Stivers and Senator Wilson from the majority in the Senate, and then we have I think a single member of the majority in the House. I think we have Reggie Thomas from the minority in the Senate, and I think we have all three members of leadership in the minority in the House. Dr. Burks is going to show them, and we'll show you tonight that presentation, very specifically how much worse this spread has gotten from March to today, going through our numbers, showing mortality across the United States and in Kentucky that this is the most dangerous time. And I think that it's pretty clear that if the legislature were to strip authority to respond, we'd look a lot like South Dakota, where there's been a choice not to do anything. And that's one of the most dangerous places to be for COVID in the entire world. I hope to show that tonight too, that if you look at what happened in Florida over the summer, which is so sad, such a significant loss of life compared to where we were in the summer. But then you overlay where North Dakota is now, it makes Florida's summer, where they had unimaginable loss, look like a blip. That shows you how dangerous it is now when there is no action, a lack of action, or constraints on that action. Corinne Boyer from WEKU.
Hi, Governor. Did you and Dr. Birx have any talk about at all how the state should communicate with the public about getting the vaccine and how the vaccine doesn't mean that things will go back to normal immediately?
Yes, thank you. We talked about that a lot, and there aren't easy answers, but we do believe that sadly we've lost so many people across the United States that people are seeing the seriousness of the situation. Just about everybody has been touched with either loss or someone that they are close to losing someone. Because of that, we believe that we're starting to see some changes in behavior that are positive, and we're also seeing a shift in people wanting to take this vaccine, but also needing, especially those that are on the front lines, those that are in high risk areas to give voice to where they are. That it can't just be the governor, but encouraging our hospital systems too. And this was a specific suggestion to talk about where they are in capacity and what it means from that system if they run out of ICU beds, because it's when somebody who has a stroke or a heart attack can't get the help they need, and we lose somebody we otherwise wouldn't. That'll never show up as a COVID death, but that's happened across the country. Alex Ebert from Bloomberg.
Thanks for taking our questions, Governor. University of Cincinnati, just over the border to your north, says that it's going to be able to give out its 975 Pfizer doses to employees by about Thursday. You receive them on Monday. Question for you is, this obviously isn't something that happens instantly. What do we tell people as they're waiting for hospital staff to get these, and as they're seeing the slow sort of trickle into these long-term care facilities, and they want to see people in the hospital, or they want to see people that they've been waiting to see for months?
So our biggest challenge moving from today to when we defeat COVID-19, well, two of them. Number one is going to be to keep encouraging people to do what it takes to stop the spread, because this war is not going to be over until it's over. And everyone we lose between now until when everybody who's willing to be vaccinated gets vaccinated, that is avoidable loss. And it's even more tragic than what we have been through. The other challenge is going to be so tough is patience. Whether it's folks at one hospital versus another, whether it's folks within one hospital system right now, whether it's which nursing home is CVS and Walgreens going to go to first. And then it's people wanting to see their loved ones, knowing that a vaccine is out there, but maybe not being able to fully internalize that we haven't been able to get it out everywhere yet. Patience is going to be the virtue that we're going to need over the coming months. Now, in long-term care, we do have a very aggressive schedule where we hope by March 1, in other words, into this month, January and February, to have vaccinated everybody who's willing, both residents and staff, all the way through assisted living. In other words, that entire population. What I'd say to others out there that would like to get vaccinated during this period is that's 66% of our deaths in Kentucky. That's who it comes for. So we're talking 2.5 months, right? Let's understand that period of time and the need that's there. And also that we got to be patient on the visitation side too. But I mean, there's a great light at the end of the tunnel. I mean, we can see the moment when You're going to be able to see your relatives regularly instead of intermittently when so much of the difficulty of visitation is going to go away. I mean, it is out there, but the virtue of patience, it's going to really be tested between now and when we defeat COVID-19. I hope by the end of spring next year, but the difference in when we defeat it, I believe, is spring or summer. And so that's really exciting. Kristen Edwards from WLEX.
Thank you, Governor. Now that the Electoral College has solidified Joe Biden's win, have you gotten any guidance on how the transition will affect your coordination with the White House going forward?
So the first, and I think I was able to do this before, but let me congratulate the president and the vice president-elect on the Electoral College vote. The Biden transition team has been communicating with various members of our staff, including on the coronavirus. I will say that we have had a very good working relationship with this White House and this administration on COVID. The communication has been good. We hope and we expect that will continue. Certainly some of the individuals are staying, like Dr. Fauci. So things that we're communicating right now is need for a seamless transition, how desperately we're going to need funding for testing, for tracing, for disseminating this vaccine from the federal government. And that right now may be the number one threat to distributing this and distributing it well. And then also talking through some of the federal discussions that are going on right now as far as prioritizing age or occupation. And that's a difficult conversation, each side of which presents its own difficult logistics of getting this vaccine out. There's no question that the logistics of vaccinating, we hope over 70% of Kentuckians for whom this vaccine is safe over the next, we hope, 5 months is one of the biggest logistics challenges we've ever faced, but I'm ready. I'm excited for it. Now, people should know, in addition to being patient, they got to understand it's going to be a little messy. There's no way that we can get this much vaccine out there perfectly in perfect order that everybody agrees with. But I hope people understand that we're going to be doing it with speed, because every day, especially, that goes by that we don't reach the most vulnerable is a day that we may lose them. So we expect a positive relationship, certainly, with the new administration starting in January, and we'll be watching how the transition goes as we move forward. Certainly, the President-elect Biden talking about mask wearing for the first 100 days fits a timeline that is helpful, and his example of wearing a mask each and every day, I think, is very helpful. All right, I want to thank everybody. This is a good day. It was good to hear from Dr. Birx. I want to thank her for her partnership and the partnership of the White House Coronavirus Task Force during these many months. We'll be back at 4 where we can answer other questions. We'll give our report for the day, and Dr. Stack will actually walk through Dr. Birx's presentation. Thank you all very much.